CTA and DAISY websites. And at the end of the webinar today, an evaluation will be sent to you. It will take just a couple minutes to fill it out, and we really appreciate if you could take the time to do that. Okay, next. All right, so joining me today are Megan Cox from DAISY, Carrie Friedman from DAISY, and Brenda Sharp, who leads Louisiana's Part C work. She will be sharing how her state has used qualitative methods in their SSIP work. What we're going to hopefully accomplish today is to answer these questions. What are qualitative methods and when might you use them? Why should you consider using qualitative methods? How can you obtain high-quality qualitative data? Because just as with quantitative data, you can get poor quality or high-quality data depending on the methods that you use. Then we'll talk about how you can systematically analyze qualitative data, and we will conclude with how can you summarize and share qualitative data in engaging ways. We're going to start with some definitions. When we talk about quantitative data, we're talking about numbers or information that can be counted or quantified. So this would be counts, ratings. If you have ever checked a box on a survey, that's typically considered quantitative data because those boxes, whether you checked it or not, can be counted very easily. When we talk about qualitative data, we're talking about information that cannot easily be understood through numbers. So this would be text-rich information, stories, quotes, images. These would all be qualitative. And today, when we talk about methods, we're talking about the processes and tools that are used to collect qualitative data and to analyze qualitative data. So thinking about when you might consider using qualitative methods, well, first, when you want to collect information that isn't easily quantifiable. A great time to use qualitative methods is when you need a detailed understanding of an issue. For an example, if your state was struggling with a policy issue, you might consider conducting interviews with people who are knowledgeable about how that policy came about and ask them questions. You know, what was the political and legislative context to gather rich information that can help you understand what's happening currently. Another time to use qualitative methods is when you want to further explore and better understand findings from quantitative data. Let's say that you administer a survey with program or school staff and you ask them, how often do you use particular state resources? And let's say you find out that they're not using them. You might follow up with interviews or focus groups to better understand why that's happening and use that data to improve those resources or improve how they're used, that kind of thing. And then also, qualitative methods are great when your focus is exploratory. And by that we mean when you're not exactly sure what you want to ask, but you know there's a general topic. So you might start with people with some very open-ended questions. And as people respond, you follow up with more questions. And that is a great way to collect some very rich qualitative data. Thinking about why you might consider qualitative methods. First, no single method can tell the whole story. Every data collection method has its limitations. And this is why we often recommend that you use a mix of methods, both quantitative and qualitative, so that you can look at a topic from different angles, from different perspectives, using different sources of information, and hopefully tell a more complete story than a single source. As I mentioned, qualitative data can be used to explore, understand, and explain what is happening, so that's a great reason. And then qualitative data can bring numbers to life through vignettes, quotes, stories, and oftentimes this helps stakeholders relate to the findings in a better way. Here are some methods that are commonly used to collect qualitative data: interviews, focus groups, having people write in a journal or a log, and using open-ended questions on a survey. I wanted to give an example of a mixed methods approach. So here's a state that has an evaluation question, and their question is interagency coordination and communication improving in the state? Why or why not? This state chose 2 data collection methods to answer this question. The first is a structured survey where they gathered information to, like, how often do you communicate with staff from other agencies? The advantage to a structured survey is that they can gather this information from a lot of different people. Once the survey is developed, it's pretty easy to ask many people to fill it out, and it's fairly easy to analyze that information as well. This state also decided to conduct some interviews with a sample of staff from different agencies to dig deeper into what's really happening, to better understand the whys, what's going well, what's not going well with interagency coordination. And so with these 2 methods, they're providing a more complete answer to their question than one of these methods on its own. Okay, now we want to engage you in thinking about scenarios that would be appropriate for qualitative methods. So we are going to have a poll and want you to consider these 4 evaluation questions and tell us whether you think each of these questions, if qualitative methods would be appropriate to answer the questions. So I'm going to read the evaluation questions and then we will pull up the poll. Question 1. Are practitioners reaching fidelity on implementation of evidence-based practices? Number 2, what challenges are families having in accessing services for their child? Number 3, how many administrators and providers attended the trainings on child assessments? And number 4, are children improving in their acquisition of early literacy knowledge and skills? So the poll is up, and you can check more than one, and we will give you a minute to think about that. So which ones of these would be good for qualitative methods? We're going to let people think about that, and once we have a number of responses, we'll share the results.
There were about 50% response, still climbing.
We're going to have a couple other polls. If the poll is, if you don't like where it's placed, you can actually drag it, click on it, and move it to the side.
All right, I think we're petering out about 32 votes out of the 48. Can we go ahead and end it? Oh, 75%. I think we're good.
Okay, so the third question, how many administrators and providers attended the training, had the lowest response. And I would agree that probably a quantitative, like a attendance sheet where you just count up how many people is probably an easier strategy. Most people selected, 92%, the second one, what challenges are families having in accessing services for their child? I would agree that that is a great place for qualitative methods. And then for the first one about fidelity and the last one about children, yes, qualitative methods could be used in those situations. Often as a state, it's impractical to use qualitative methods for those kinds of things because as a state, if you want to summarize the information across the state, those would be, quantitative methods might be better for that purpose. All right, so that is it for the poll. And as we mentioned, go ahead and type any questions that you have in the chat, and we will do our best to answer them. And I am now going to turn it over to Brenda Sharp from Louisiana Part C.
Hi, everybody. Thank you for the opportunity to share how we came to use some qualitative methods in our work on our SSIP. And in order to do that, I'll kind of give you a little bit of the historical context that led up to these activities. So our simmer for SSIP is improving child outcomes through supports that are focused on family concerns, priorities, and resources, which is our term for our family assessment, and provided through a team-based approach. And so there were, from the beginning of our work, we had identified that there were two practice areas that we wanted to improve in order to address those two components. And in working towards selecting our evidence-based practice in order to accomplish this, we were led very naturally to the DEC recommended practices because of their focus on family assessment and team-based supports. So as we were progressing along with our work, we had a stakeholder meeting to focus on how to move forward with the DEC recommended practices and our focus areas for our simmer. And we began looking at the practices. We had a stakeholder retreat, and through our discussions with our stakeholders about the two areas, we realized that in order to address all the components, we also needed to look to make sure that our service delivery providers were addressing family priorities in their practices as part of service delivery. So we added that third component as a way to incorporate all the areas that we wanted to improve. And so you could see that for those three areas, we crosswalked those with the DEC practices that most directly related to the practice areas. We had a retreat, and Debbie Shaver on the call with us today, and one of our attendees, also one of our TA providers, Grace Kelly, facilitated our discussion to decide how we wanted to proceed with making practice changes. And we used a book called Switch, which many of us are familiar with. It's called Switch, How to Make Change When Change is Hard. And that framework for making change is very clear about making sure that you are, quote, directing the rider. In other words, that the participants in the change process are very clear about where they are going. And you can move to the next slide. So we made some assumptions as part of that discussion, and our stakeholders sent a very clear message about the practices in the three areas. They said, we know that we are not consistently implementing these practices around the state, and we want to accomplish the four things that you see there. We want to make sure that we are defining the practice as the switch model suggests, so that everybody is clear about the direction we're going in. We want to assess how each practice is being implemented in Louisiana, and we want to define the components that make up each practice. So what are the key features that define that practice? And then, because we know there's inconsistent implementation, we want to identify where we have bright spots, where that practice is being implemented well. And then, not showing on the slide, but part of our discussion was that we want to make sure we're consistently messaging these components across all parts of our system so that everyone knows what the expectation is from the very beginning. So as part of our discussion, Grace Kelly recommended that we use practice profile methodology, and which is one of the key features of implementation science, to define what is being implemented, how it's being implemented, and where it's being implemented. And this was a nice match with the switch framework. At first I thought, when we had this discussion, well, we're really kind of beyond that because we know what the practices are. But I was reviewing the information on the implementation science website, and I stumbled upon a white paper written by Allison Metz called Practice Profiles, a Process for Capturing Evidence and Operationalizing Innovations. And there's a reference to that at the end of part of the slides. But this really spoke to us because it is the process that the switch framework outlines. And so it was a very good way for us to have a process to specifically define the practice. So you can go on to the next slide. So this method outlined the areas that we were charged with to define the practices. And you saw the slide that had the 3 work areas: family assessment, service delivery, supporting family priorities, and team-based practice supports. We had 3 groups that were where stakeholders volunteered or were asked to participate in one of those 3 groups. And they began to decide how they were going to collect data to define the practices. And 2 of the work groups decided to do a survey, primarily a quantitative method. And the family assessment work group decided they wanted to conduct interviews. And so this led us to the qualitative methodology. And this process was chosen because, according to that methodology, we wanted a more detailed understanding of the problem, but it didn't align itself well with counts of how many people were using it, et cetera. So we selected both of these data collection methods to define the practices. And so we had a combination of interviews and surveys. And then using the practice profile methodology, we wanted to crosswalk what we were defining with our policies, our practice documents, the recommended practices, et cetera. So the group that was going to use the interview methodology targeted 3 groups initially: families, support coordination agencies, which are our case management agencies, and our system point of entry offices, or our SPOs. So you can go to the next slide. So in this methodology, one of the things you want to make sure is that you're clearly defining the process at the beginning with careful planning to make sure you're getting the data you want on the back end. So the family assessment work group decided they were going to conduct these interviews with key stakeholders in our system that were outlined on that previous slide. The SPO staff, they wanted to talk to both intake coordinators and directors of the SPO agencies. And we have 10 of those, so they wanted 2 individuals from all 10 agencies. They wanted to talk to support coordinators who work for agencies, some actual support coordinators or case managers, and their supervisors. So they targeted, we have 32 of those agencies, so they targeted a number from each region that they wanted to get interviews with. And then families, which we felt were key stakeholders in the process. And so they targeted a certain number of families in each of those regions. Then they identified who among the work group members were going to conduct the interviews. And then each target group had a set of questions that they were going to use to address the areas specific to the participants in the interview. So, for example, there was one set of questions for families based on their experience with family assessment, and a different set of questions for intake coordinators and dispose, for example. And then the interviewers were trained in how to conduct the surveys. So everyone was addressing the interviews in the same way. So for in this qualitative methodology, another recommendation for success is to have periodic check-ins to make sure that you are getting the results that you expect. And so the work group was meeting by phone more frequently than their typical quarterly meeting while this was underway. And at one of those check-ins, they determined that they had not thought about interviewing the actual evaluators in our system who are doing the eligibility evaluation with the children. And so that group was added later. So that was the benefit of that check-in at that point, was to realize that there was a gap in the process. The other two work groups, as I mentioned, had determined that they were going to use surveys. And each work group was going to develop a set of questions for their own survey, and we were going to host them on SurveyMonkey. But then as we at the central office level were reviewing the surveys, there were so many questions that were similar, we decided to combine them into one. And so it was a 43-question survey, but there were some open-ended items on the survey. So some portions of the survey yielded quantitative results, but some of them were designed to be qualitative in that we could capture additional information through open-ended questions. So the points that on the slide actually outline the process that the work groups used. You can go on to the next slide. And this is an illustration of how the protocol for the surveys was developed. So this is an example for one of the questions. The first column is the question itself. So this one was for the families who were interviewed. And so that was the question that the interviewer would ask. And then the items in the middle column were things that the interviewer should listen for by way of a response. And if they heard that item in the person's response, then they could just check it off. They didn't have to write anything. But if they didn't, then there were some prompts for discussion points and questions to elicit responses specific to that question. And these were all designed to be discussion questions that would not yield just a yes-no response. So it was really to dig in and get as much detail for each question as possible. And then the third column was a place for them to record any responses that weren't previously captured, or any other discussion or follow-up things that might have come up. They targeted across all those groups, the 4 groups that I mentioned, they targeted about 208 respondents, and they received about 150 responses. They were actually able to do about 150 interviews, or 72% of all the targeted responses. And then related to the online survey, which typically would have been more quantitative measure, there were questions like, early steps can improve its practices in 3 areas by, and then they could select from a few choices, or they could add in some items. And for that survey, about 45% of the participants on the survey actually added items for as responses that we had not, selected ahead of time. Can go to the next slide. So here was kind of how the result worked. In the qualitative methodology, one of the recommended processes is that you develop a coding strategy to code the responses. And Debbie is going to talk more about this later. But because the interview process took longer than we anticipated, remember we added a group kind of midway through, we knew we would not be able to take the time to code each response. So we basically just, all of the survey results, interview results went to one person, and then she was able to review them and group them into large buckets where the responses fell. So it wasn't the ideal way to summarize the results, but it addressed the issue that we basically wanted to accomplish. And then we were able to take the information and plug it into our practice profile that we had developed. It looks a little bit different from the one that's in the implementation science method, but it really helps us with how we plan to roll forward with identifying the practices in the area. So I'll just kind of walk you through it. Remember we have the 3 practice improvement areas, and the one that used the qualitative method process was family assessment. So for the family assessment profile, they had an outcome for what they hoped to accomplish through the family assessment. So that went in column 1. And then all of the family assessment pieces in our system, then the next column, outline the DEC recommended practice that could be attributed to this area. Then we identified through the interviews and the quantitative data that we had what the practice looked like in early steps. And then from that, we identified what we felt were the core features of the practice that had to be in place for it to be the practice that we said reflected family assessment based on the DEC recommended practices. And the way we defined that was saying that that feature had to be observable, measurable, and teachable. And if it was all 3 of those things, then it was something that we could measure to say that the practices was being implemented. And then from there, we could take those core features and develop a fidelity measure where we could then go back and assess performance to say, yes, you are implementing this practice the way we defined it through this methodology. So here's what we learned from the practice. If you remember what we were charged with in an earlier slide, stakeholders said, we think that this practice is being implemented inconsistently throughout the state. And we found that to be the case. Through the interviews, we found that all of the stakeholders who were interviewed were implementing the practice slightly differently. Family experiences were a little different from region to region or agency to agency. One of the values that we had identified as part of this practice is that everyone would be talking the same talk and training new people who came in to use the same language through use of scripts, et cetera. Agencies were not using scripts. One of the values in working with families, according to the recommended practices, is that you should prepare families for any kind of meeting that's coming up, and we had discovered that our support coordination agencies were typically not preparing families prior to each team meeting. One of the values in our system is that our eligibility evaluators work directly with our SPO intake coordinators to conduct the eligibility evaluations. We found that in some agencies this was happening 100% of the time, and in other agencies this was happening 0% of the time. Another value in the family assessment process for us is that the family assessment does not occur as an isolated event, but that it's a continuous discussion. At every contact with the family, you take whatever information you glean from that conversation, and all of that information is combined to help identify family concerns, priorities, and resources. And we found that in many occasions that it is occurring just as an isolated event where you sit down with a family and do an interview type process and result in the family assessment as if it were a one-time thing. So there was a lot of benefit to using the interview process because it did give us the responses to what we were charged to do for the stakeholders as far as defining the practice. If you go to the next slide, then these are the resources that I've talked about. The white paper about the practice profile, the switch, how to change when change is hard, and then a document that we'll be talking about later in the webinar related to using qualitative methods. So that was Louisiana's experience.
Wonderful. Thank you, Brenda. And this is Megan. We are going to pause here for a short break to respond to any questions that you may have as a result of Debbie and Brenda's presentation. So if you have a question, please unmute yourself. And you can do that at the bottom left-hand side of your screen. Or you can also type your question into the chat box. And so we'll pause to let you formulate your questions before moving on to best practices. Oh. And we did get a response in the chat that it doesn't look like participants have an unmute option. Thank you for that. So if you do have questions, please type them into the chat box and we will respond to them in that way. All right. And while you are formulating any questions, I do want to just mention the resource that Brenda had in her previous slide, which is the DAISY resource that is strengthening SSIP evaluations with qualitative methods. This is a resource that is on the DAISY Center website, and the next section will have some of the best practices that are listed in that document. So please have, feel free to go to the DAISY Center website and take a look at that product. We do have one question, and the question, Brenda, is how did you recruit families for focus groups?
Since we were focusing on the family assessment, which begins shortly after referral during the intake process, we asked each of the stakeholders in the work group who were working in our system point of entry offices to identify some families who had just been through a family assessment. And then someone else other than, for example, their intake coordinator or support coordinator called them and asked the interview questions.
All right. Great, thank you. And we had one additional question that we will be addressing later in the presentation. So we'll go ahead just in the interest of time and move on to best practices that are highlighted in the DAISY product. So next slide, please. Just to reorient you, when we're thinking about qualitative methods, we do really want to pay particular attention to the purpose for collecting qualitative data. And as Debbie mentioned at the beginning of the presentation, there are really distinct purposes for using qualitative data. And the first is to potentially explore a new process or explore an area where there may not be any data available. Additionally, it's to explain a phenomenon or changes in particular implementation or programs, and then also understand a program or specific area in more depth. And so one best practice is to not collect qualitative data without understanding why you're doing it. This is something that you can ask yourself and your team as you're thinking about your evaluation questions, particularly related to the SSIP. Are there opportunities to explore a process? In what ways do your activities address a process or impact any kind of implementation? And then you can match your data collection methods to the nature of the question. And particularly in the product, we do ask specific questions about the nature of your evaluation questions, and you can see some of the suggestions here. We also want to express the process of evaluation questions when you're thinking about formulating these questions and thinking about qualitative data collection, that you pay particular attention to the opportunity for mixed methods. So next slide, please. Once you have an aligned data collection method with, a data collection question that includes qualitative opportunities, you really want to clarify the purpose. What will this data be supporting in answering your evaluation questions? Once you feel confident that you have the need for qualitative data, you can think about selecting this appropriate method. In our publication, we reference 3 methods for collecting quantitative data: interviews, focus groups, and document review. Each has its own requirements as well as some pros and cons, and the publication lists those in great detail. However, there are some commonalities among all of them, and the first is all require resources. So you need to ensure that you have the appropriate resources to support your qualitative data collection. And resources are personnel, being sure that you have adequately trained personnel. You also need equipment, such as laptops, possibly Wi-Fi hotspots, if you need to upload your data and information. Recorders are often a good idea. So you need to take all of that into consideration when you're thinking about selecting a data collection method. So just be aware that training data collectors and organizing equipment will be a part of this process. Also, we need to think about sampling and being very intentional about participants and expectations for data collection. And as Brenda mentioned, this was a central part of their planning process, being very intentional about which participants they were going to focus on. And that was one of the first steps in their interview process. So being very clear on the participants and who you would be interested in collecting data from will be central to the planning. Also, when you're thinking about sampling, you want to make sure that you have a diversity of voices. Because qualitative data collection is fairly intensive, it's really important to select participants where multiple and diverse voices are collected. And so you have the diversity of your population in mind. Okay, next slide. You also, in thinking about data collection, when you're planning, you want to make sure that you have the time to devote to developing and using protocols. And again, Louisiana was a good example of this, where they had identified data collectors, they developed protocols by participant group, and were able to uniformly collect data in a meaningful way. And this is something that will take some time to complete. And so what we have here on this slide are just a few of the steps that are outlined in the product specifically related to the development and use of protocols. It's a really good idea to think about how you're going to recruit participants, especially if you're looking at families and service providers who may not be in a metro area, who may not be close to your agencies. You also want to make sure that they represent the information that you need. You will need to plan for data collection and also ensuring that data collectors are collecting information in a uniform way, and anticipate challenges related to data collection. And so it's good to, when you're thinking about planning ahead, to have some contingency plans in place for scheduling as well as for data collection issues. Another plan ahead is to develop a monitoring plan. And by that we mean, in what ways are you going to consistently communicate with data collectors while data collection is occurring? In what ways are you going to monitor the quality of the data that's being collected? And then also, how will you be making adjustments? Again, that goes back to anticipating some of the challenges that are related with qualitative data collection. We also, in thinking about planning ahead, can pay particular attention to the particular types of data that you would be collecting. So for instance, in focus groups and interviews, the pros of those two particular methods are that you have responses in real time and data collectors are able to react to questions and contingency questions, probes in real time. Interviews, you have the opportunity to have a bit more of a confidential conversation, whereas focus groups, you have the banter of the group and individuals may be able to respond to one another's responses. Document review also provides some insight in a different way to either the exploration of a phenomenon or the implementation or trends. In particular, these are valuable data collection methods when a change has occurred or you're implementing a new practice and you have documents from before the practice was implemented and after, so that you can examine historical trends and better understand the nature of the changes along the way. Next slide, please. And the last step when we're thinking about qualitative data collection is the analysis of the data. Again, you've been preparing for the analysis all along. You should have an analysis plan and then be thinking about how you're going to prepare your data. And you can categorize your data in a number of different ways. You can use particular software packages to upload your data and transcribe into software packages. But essentially, you need a clean set of transcribed notes and particularly some data collector notes as well, and prepare your data in a very systematic way so that when it's time to analyze the data, there's minimal cleaning and adjusting. And then when you choose your analysis approach, you will want to think about, again, the purpose and intent of the data collection. So going back to your research questions and your evaluation questions. And you want to make sure that the approach will match expectations. So when you're thinking about developing codes, what are some anticipated responses or anticipated themes that you think will come from the data collection? You will also need to train coding staff and think about who will be coding all of the data. Will you have multiple coders who will come to consensus on the codes and on the themes through an iterative process? Will you use computer system or software systems to help build the codes in a more exploratory way? You will then need to actually code the data and summarize and synthesize the information. So again, this is an iterative process that will take some time, but yield rich information that has depth and detail that is very complementary to quantitative data. And next slide. I think we are now moving into the coding activity.
Yes, so together we're going to do a quick coding activity, and I'm hoping that this is going to address Greg's question before on what are some tips for grouping themes and categorizing. So here we have, and this is just one way of doing it. This is not the only way. So let's say that this is a state that has conducted some focus groups. So what has already happened is that multiple focus groups happened. Notes from those focus groups have been typed up, and so now the team has a set of notes across multiple focus groups. And the job of the team is to do some coding, and this question is just one of the questions that was posed during the focus group. So this isn't the whole focus group, but one of the questions that was posed was, what challenges have you had with implementing the team-based approach for serving children and families? And so what the coders are going to do is read through all of the typed up notes and look for any evidence about this response. So anything that has to do with challenges, they would code, and if it was a printout, you know, they could handwrite the code in the margin where they saw that evidence. And so in this case, so Megan mentioned that you know, you can start by with some preliminary ideas on what some of the themes might be. So in this case, a staff member or a group of staff members, either through what they expected to find in the focus groups, but also maybe reviewing a few of the focus group notes first to try to identify some themes that are popping up more than once. And so after having done that, they created these 6 themes around challenges around the team-based approach. And the coders, as they read through, they're going to decide if they see something, does it relate to communication issues? If so, they would write C1 in the margin. So we are going to do one example and practice doing this. And so here, here is the question again, what challenges have you had with implementing the team-based approach? And we're going to do the polling. And what you can do, because on my screen, the poll is blocking the quote, I'm going to drag the poll to the right so I can see the full quote. So what we're asking you to do is to read that quote and then look at those 6 possible codes and check the ones that you think are evident in this quote. And hopefully I was clear in my instructions. You can check more than one. So read the quote, the focus group response, and because there's a couple people on the phone, I'm going to read it out loud, and then you can think about which code. So the quote from the focus group is, I'm not always able to bill for my time in a team meeting. I can't participate in a team meeting if I can't get paid. This is a major problem. I would also say that not everyone is a team player. A team-based approach works for some people, but not all. So now use the poll to code this quote. And if you see a challenge that isn't represented in the first 5, you can use C6, which is other. So go ahead.
All right, we've been at a 60% for a little bit. Anyone else? Going once? Okay.
Okay, so almost everyone selected C4, billing for time in team meetings. The next highest response was conflicts between team members at 72%, and a few people had other issues, coded other responses. So what would happen, this would be very typical. You know, you're gonna have different coders come up with different things, and especially at the beginning of the coding process, this is where you would have a conversation to have people share why did they pick that code. And this is also where you might want to tweak the response, the responses, possibilities. So for example, many of you selected C5, conflicts between team members. You might decide as a team, maybe we should broaden that a little bit and say, let's call it, you know, interpersonal issues, or, you know, something like that. So you would discuss it. And then, so what's happening is people are coding through, and after the coding, those codes could be summarized in different ways. So you could look, okay, in every focus group, we found communication issues was mentioned. And you could look at sort of themes that way, and you can group them in bigger themes. But the coding is the first step of really systematically understanding what's in the notes. Okay, I'm going to stop there. And Kellen, we're going to skip the second example. So let's just go, and I'm going to turn it over to Carrie.
All right, thank you. Well, we have just a few minutes left, so I'll go rather quick through this section. There we go. But I do want to talk about summarizing and sharing your data. So after we get through all of the planning and data collection and analysis, we get to summarize, share, and use the data. And often with qualitative data, we're summarizing through those key overarching themes like we talked about. Sometimes, not always, numbers are the best way to summarize the data. And often we'll want to back up whatever themes or numbers we pull out with more detailed findings and relevant quotes or examples. So we'll do those things, and then we'll get ready to create data displays. I'm going to share a few examples of qualitative data visualization, and these may get you outside of your comfort zone a little bit. So with data visualization, we often go to our standby favorites, like those bar charts, pie charts, etc. And qualitative data actually opens up a ton of new ways to share your data creatively and effectively. So when you're displaying qualitative data, you don't necessarily need to quantify it so that you can do those bar charts and pie charts if that's not useful for effectively sharing the data. And also remember to follow those general good sense rules for data visualization, being intentional with your titles, labels, what display you choose for your data, and then using color and boldness effectively. So we're going to look at some examples. The first one here is a word cloud, which we've probably seen before. It provides a visual display of the number of times a word appears in a text. So typically words that appear more frequently in the text are displayed larger. A word cloud can be a good first step in seeing words that come up over and over again in an interview, a free response question, or a focus group. And there are lots of free online tools that you can find in our data visualization toolkit that can make these really simple to create. Often when we want to share quotes, when we're trying to summarize or bring attention to important aspects of a longer text, Bolding text within a quote can really drive home the key words, key messages. And then adding a picture can really humanize your findings. So here are 2 ways to display quotes that are effective. You might also want to organize your quotes in what's called an evidence matrix. So identifying and grouping the common themes or concepts that come up in the quotes in a visual like this. If you're writing a report or sharing your presentation, using icons whenever a particular theme comes up is really helpful for the viewer so that they can make connections throughout your report or presentation to the overall themes. You might also want to map those themes that come up in your interviews or your focus groups with this kind of heat map. So here we can see that respondents agreed most with some of the statements on the left, both by respondents and then across respondents by theme. Again, this is another display you can easily make if you take a look at our toolkit. You might also want to compare different groups or themes or levels of implementation emerging from your qualitative data. And these gauges are a really fun way to display comparisons. You'll sometimes see these used for quantitative data, but they're actually not very precise visuals for quantitative data. So I recommend using them for qualitative data. This is another one where we have a downloadable template in our data visualization toolkit that you can use to create your own gauge. And this visual kind of is a cross between the icons and the gauges. So they're icons that can be used to draw comparisons throughout a report or presentation. So I went through those really quickly, but I'll share our resource where you can find all of those with further explanation right after this. So the visualizations I shared are really all in support of sharing qualitative data with stakeholders. They're intended to support you in asking questions like, are the results what you were expecting? What's surprising? What are the implications for further evaluation and improvement work? And remember that your qualitative data can be used to provide a context for understanding what numbers mean. So do share your qualitative data along with your quantitative data, for example, to help you understand what happened during implementation that may help explain that quantitative result you're seeing. So I'll finish off this section with our resource. This is our data visualization toolkit. We do have a new-ish section on qualitative data that you'll see right at the beginning of the toolkit, and it has all of those displays I shared with some downloadable templates and further resources. So Debbie, I'll let you close things out.
Okay. We are sorry we are out of time, but I just want to make sure you know where to get this resource on strengthening SSIP evaluation. It would apply to any program, not just SSIP. Some great tips in there that's on the website. As a reminder, we will have the slides and the recording on the ECTA and DAISY website, so you can easily access those links. Next slide. I think it's just questions. So we've run out of time. We will stay on for a couple more minutes. If anyone does have a question, just type it in the chat. We think there is a way to unmute. If you scroll down to the bottom, the icons should pop up, but it's kind of late for that anyways. But if anyone wants to stay on a couple minutes, we're happy to answer any questions. And as we mentioned before, we encourage you to complete the evaluation of the webinar. We really appreciate when you do that. And so I think that is it. Again, if you have questions, we'll stay on for a couple more minutes. Thank you, everybody, and good luck with qualitative methods. And we're happy to provide further assistance through TA support. Carrie, can you go back to the slide on the toolkit? Someone wants the link. Or maybe you could copy it and put it in the chat. Thank you. Okay, it sounds like we don't have questions. So we thank everyone for participating.